Good morning, Doc Irish. Good morning, classmate. I will be reporting to you the family therapy on the first part. This will be the main topics. We have the general overview of the family systems therapy, the confidentiality and dealing with secrets, considering the cultural perspective, the key themes and issues, as well as the assessment, the system as the problem, personality, forming a relationship, and the gender abuse and family therapy. So, our case approach to family therapy, we have this general overview of the family systems therapy. So, we all know that family therapy is both a theory and a treatment method. So, it offers a way to view clinical problems within the context of a family's transactional patterns. It also represents a form of intervention in which members of a family are assisted in identifying and changing problematic, maladaptive, repetitive relationship patterns, as well as self defeating or self limiting belief system. So, depending on the specific orientation of the family systems practitioner, this approach has a variety of goals. So, this includes resolving the presenting problems of the client and the family. Then we have resolving family crisis as quickly as and efficiently as possible. And then we have also creating an environment where new information can be infused into a system and allowing the family to evolve on its own. Then restructuring a system so that autonomy by all family members can be encouraged, and then in changing the rules and patterns of interaction among family members. And then we have also teaching communication skills and problem solving skills. Confidentiality and dealing with secrets. So therapists may decide to see only the concerned client in the beginning and later invite others in his and her system to attend therapeutic sessions. So, a decision family therapists often make a prior to a client's first visit is whom they will see. So, many insist that a client's entire family be seen during the first visit, given the variety of systemic approaches available. So, in that case, the matter of confidentiality must be addressed. No, the therapist need to decide if what a client reveals in an individual session will be kept secret. But a safe rule, no, in working with the families is not to keep secrets. The therapist needs to decide if what a client reveals in an individual session will be kept secret. It should not be noted that many. It should be noted, sorry, that many system therapists avoid seeing the concerned client first. No, the concerned client first, partially because of the problems involved with deciding how to deal with this client's disclosures in family sessions. But to be clear, though, once a person has been seen individually, except in case of harm prescribed by state laws like family practitioners who are who belong to an American Association for Marriage and Family Therapy, are bound to keep those sessions confidential. So present this policy in writing and encourage clients to discuss its ramifications. So this contract informs clients of the risk involved with the therapy process. So this definitely applies in those situations where the law mandates that the therapist reveal information indicating that clients are likely to harm themselves or others, and in child in child abuse cases. So even the law does not mandate revealing a secret. But it is advisable, of course, to inform clients of any policies that apply to dealing with secrets. If secrets are kept, the therapist will certainly have a difficulty time doing effective therapy with various parts of a family system. So the therapist can easily forget what may not be said when the entire family gets together. So for this reason, many family therapists refuse to become entangled in keeping secrets and let this be known from the outset. Of course, clients and family should be clearly informed about the legal limits of confidentiality from the beginning, just as would be the case for individual therapy. Then we have considering the cultural perspective. Of course, family therapy is concerned about how the family is influenced by their ethnic and cultural perspective. So, family therapies are concerned. Thus, it is also important, or what might be observed as an effective hierarchical structure in a, for example, in a white middle class family, may be a quite normal, no, if observed in a Latino middle class family. For example, in a Latino family, having the grandmother, no, taking care of the or having the grandmother take on the parent role for the grandchildren may be cultural normal for them. So just in the case of Ruth, no, However, a grandmother in Ruth's family is taking on the parent role, no, might create problems in the system because if the grandmother in Ruth's family is the Ruth's mother-in-law and she is forming a coalition with Ruth's husband regarding the rearing of their children, this would definitely impair Ruth's role as a parent and would most likely lead to difficulties in the spousal subsystem. Thus, it is important, no, to 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 consider the family's cultural perspective before determining whether certain behavior is to be considered a problem and what might be considered a measurement in one family may be normal for another family. Key themes and issues. So we have here the developmental approach, which is a theme of family states becoming central to the treatment process, and we have the structural in which the boundaries of the system, as well as the rules for communicating are also quite important. So as you can see, the structural intergeneration model integrating some ideas in the process developed by Murray Bowen. So this is the approach treatment in Ruth's case, no? So our rationale for working from this integrated perspective is that from the Roots case now, Roots' primary concern regarding change is related to a significant transition in the family life cycle. So of course, Ruth is returning to school and hopes to begin a career as a teacher. Her children also are getting older as Ruth reaches a middle age and she is facing an empty nest in just few years. A family frame of reference. So this family, of course, a family frame of reference, sorry. This is a stimulated series of family focused methods for collecting data and understanding the individual functioning. Then we have reciprocal causality. This is a view. This view provides an opportunity to observe the repetitive ways in which family members interact and to use such data to initiate therapeutic intervention. So family therapies therefore direct their attention to the dysfunctional or impaired family unit rather than to a symptomatic person who is only one part of the family system and by his or her behavior is seen as an expressing the family's dysfunction. The family as a system. So they view the family as an ongoing living system, a complex, durable, causal network of related parts that together constitute an entity larger than the simple sum of its individual members. So that system in turn is part of a larger social context, which is the outside community. The relevant key concepts that are central to understanding how systems operate. We have what we call the organization. It is a system composed of units that stand in some consistent relationship to one another, and thus we can infer that they are organized around those relationships. But we have also what we call the wholeness. In similar way, units or elements once combined produce an entity, a whole that is greater than the sum of its part. So a change in one part causes a change in the other parts, and thus the entire system. So if this indeed the case, argue system theorists that adequate understanding of a system requires study of the whole rather than separate examination of each part. So no element within a system can ever be understood in isolation since elements never function separately. So the implications for understanding family functions are clear. A family is a system in which members organize into a group forming the whole that transcends the sum of its individual parts. We have Gregory Bateson. No? He is an anthropologist who led an early study in which he and his colleagues hypothesized that schizophrenia might be the result of a pathological family interaction. Although not a family therapist himself, Bateson deserves a special credit for first seeing how a family might operate as a cybernetic system whose current views of the regions of schizophrenia emphasize genetic predisposition exacerbated by environmental stresses, but Bateson's team should be recognized for first focusing attention on the flow of information and the back and forth communication patterns that exist within the families. So rather than studying the content of family what transpires, family therapists were directed to attend to family processes, the interactive patterns among family members that define a family's functioning as a unit. We have what we call the cybernetic epistemology. So this is cybernetics based on the Greek word for steersman was coined by mathematician, no, Norbert Wiener, to describe regulatory systems that operate by means of feedback loops. So we have here, um, instead of assuming that one individual caused another behavior, we have this. For example, he said, "You started it. I just reacted to what you did." So family therapists believe that both participants are caught up in a circular interaction. So first, we have the circular interaction. This is a chain reaction that feeds back on itself because each family member has defined the situation differently. Then we have second, each argues that other person is the cause, both are correct. So, but it's pointless to search for a starting point in any conflict between people because a complex repetitive interaction is occurring, not a simple linear cause and effect situation with a clear beginning and the end. Then lastly, we have the most familiar example such as mechanism is the thermostat in a home heating system. So just like you said, as you see, it's you set a desired temperature, no? The furnace will turn on when the heat drops below that setting and it will shut off when the desired temperature is reached. So the system is balanced around a set point and relies on information fed back into it about the temperature of the room. So thus it maintains a dynamic equilibrium and undertakes operations to restore that equilibrium whenever the balance is upset or threatened. So too with the family. We have families rely on the exchange of information, a word, a look, a gesture, or a glance that act as a feedback mechanism, signaling that disequilibrium has been created and that some corrective steps are needed to help the relationship return to its previous balanced state. So, family homeostasis is this is the equilibrium. Now, when a crisis or other disruption occurs, family members try to maintain or regain a stable environment by activating family learned mechanism to decrease the stress and restore the internal balance. We have what we call the negative feedback. The negative feedback has an attenuating effect of restoring the equilibrium. For example, couple may exchange information during a quarrel that says, in effect, so it's time to pull back or we will regret it later. So that's an example of negative feedback. Positive feedback leads to further change by accelerating the deviation. So in positive feedback, the escalation may reach dangerous runaway proportions. For example, the quarreling couple may escalate an argument to the point when neither one cares about the consequences. So in some situation, however, positive feedback, though temporarily destabilizing, may be beneficial if it does not get out of control and if it helped the couple reassess a dysfunctional transactional pattern or re-examine their methods of engagement and change the system's rule. That is, a system need not revert to its previous level, but may instead, as a result of positive feedback, change the function more smoothly at a higher homeostatic level. We have subsystems, no? Subsystems are organized components within the overall system and they may be determined by generation, sex, and family function. For example, a wife may also be a mother, daughter, younger sister, and so on, thus entering into different complementary relationships with other members at various times and playing different role in each playing different roles in the family. So we have here the three key subsystems that will always endure. They have the spousal, the parental, and the sibling subsystems. So the spousal, this is more on the first, especially important to the family. So any dysfunction in subsystems is bound to reverberate throughout the family as well as the parental, no? When effective provides childcare, nurturance, guidance, discipline system, and disciplines. And the problems here frequently take the form of intergenerational conflicts with adolescents, often reflecting underlying family disharmony and instability. And we have sibling subsystem, help members to negotiate, cooperate, compete, and eventually attach each to others. The system as the problem. So when the family therapy movement initially arose in mid 1900s, it was considered revolutionary. So its leaders were seen as mavericks who have formulated the original way of conceptualizing psychological problems and their causes. So specifically, they opposed the widely accepted notion that psychological symptoms originated from solely within the mind of the individual. So instead, they believed that psychological symptoms were a product of the dysfunctional families in which the clients live. So one individual may exhibit the symptoms, but the problem actually belonged to the entire system. Then we have here the linear and causal causality. So linear, by the word itself, it endorsed behavioral therapy suggests that events from the past cause or determine events in the present, or it's a one-way street manner. While circular suggests that events influence um, one another in a reciprocal way, such as the parents and child's behavior each affects others continuously. No, so it's more like in a two-way street. Assessment of families, like clinical work with individuals, family therapy usually begins with a thorough assessment of the family functioning. In fact, the assessment process continues throughout the therapy. They have here the genogram. This is a one helpful technique for understanding the family configuration and relationship within the family. It is a pencil and a paper method of creating a family tree that incorporates detailed information about the relationships among family members for at least three generations. So this exemplifies the saying that a picture is worth a thousand words by graphically presenting not only the structure of the family relationship, like marriage, offspring, but also the quality of those relationship, like harmonious, very close, strange, or abusive. So generally, this genogram uses consistent approach to notation. So we have here the males are presented by boxes and females by circles. Relationships are presented by lines between two individuals, and the quality of this relationship is indicated by the types of lines selected. So not only is the result helpful in understanding the complexities of the family, but the process of creating a genogram can also be a constructive way for the therapist to engage with the family and begin to establish a healthy alliance. We have here the family life cycle, no, created by Betty Carter and Monica Goldrick. So we have here living home. Okay, according to this theory, intact middle class American families typically proceed through the following seven stages. Living home is this is single young adults become independent and self sufficient. The next is joining of families through marriage or union. A new couple forms a new family system, and the spouse is incorporated into the existing family systems. Then we have families with young children. Taking care of children, adjusting the marriage, and managing child related financial and other responsibilities are among the primary tasks. Then we have families with adolescents at four. At fourth, this is the parents provide children with increasing amounts of independence and may adopt caretaking roles for their own parents as well. Then launching children and moving on in midlife. This is adjusting to the emptiness, managing relationship with children's partners, and taking on the grandparent role are central. Then six is the families in late middle age focus shifts to managing declining health and adapting to new roles in the family and community. And lastly, families nearing the end of life. So accepting realities and inevitability of death, one's own and those of family members, and frequently reversing caretaker roles between the older and the younger generations exemplify this method. Then we have conflict tactic scales. Now it has been widely used in clinical and research setting and has established reliability and validity. So even when abuse or violence is not the presenting problem, it is important for the clinical psychologist to assess for these issues by interviews or other assessment tools such as the conflict tactic scales. And lastly, we have the gender abuse and the family therapy. So um, family therapies endorse the notion of circular causality, which contends that problematic behavior within the family is part of a in which um, numerous individuals play a role. In other words, although one person may exhibit the symptom, the other family members may contribute to the problem in a reciprocal way. So I have here the questions. Questions here includes how does the theory apply to families, specifically if one partner, for example, a husband, acts violently toward the other, for example, a wife. Does the notion of circular causality suggest that her behavior somehow contributes to this violence? So, is violent, abusive behavior indeed a systemic problem that multiple family members maintain, or does the problem belong solely to the abuser? If we conceptualize a problem systemically, we are blaming the victim. So these are some of the questions, no? Okay, that's the end of my presentation about family therapy in the first part. The rest of the presentation will be provided by my classmate. So she will be tackling about key issues in the family therapy, working with diagnosis from shared hypothesis to facilitating change, as well as the essential concept, ethical issues, and how does it work, and as well as those psychotherapy applications and some of the case example and summary. That's end my presentation. Thank you very much, and thank you for listening.